My name is Professor Kirsty Short, and I'm a professor of virology at the University of Queensland in Australia. The generally accepted definition is that it's persistence or recurrence of new symptoms more than 3 months after SARS-CoV-2 infection that persist for at least 2 months and that cannot be ascribed to other causes. So you can see it's a very broad definition, but it's certainly the working definition that we have at the moment. And it is a very distinct phenomenon from just not feeling great in terms of it can be very severe. We talk to long COVID patients who are essentially bedbound. So it has a very broad spectrum of clinical illness. So long COVID can affect daily life for people living with long COVID for a really variable period of time. The majority of cases typically only seem to be about 6 months. But having said that, there's still a large number of people who experience persistent symptoms 1 year, 2 years, 3 years, 4 years after the acute infection. So it does seem to be quite variable in terms of its duration. And again, this sort of fits in with what we know about long COVID in that it's highly variable in terms of symptoms, it's highly variable in terms of duration, and that's one of the things that make it quite difficult to treat and diagnose. We certainly know that there are certain risk factors associated with the development of long COVID. So one of the major risk factors is actually being female. That's probably been the most consistent risk factor that we've seen across the world. But other risk factors include comorbidities such as obesity, the number of SARS-CoV-2 infections, where your risk of long COVID increases with the number of SARS-CoV-2 infections, and vaccination status insofar as you're at higher risk of long COVID if you're not vaccinated when you're infected. To manage long COVID effectively, I can speak for Australia, and in Australia we have a paucity of long COVID specific care or long COVID specific clinics. And these are really important because they take an integrated approach to treating long COVID. So you obviously need to have contact with GPs and any associated specialist, but then they also have other specialists there, so respiratory physicians, psychologists, because obviously long COVID can actually be quite a mentally draining condition, as well as rehab teams in terms of physiotherapy that can help with things like graded exercise. So it really needs to be a very interdisciplinary approach to long COVID. And at the moment, our healthcare system just really, it wasn't prepared for that. People didn't expect long COVID to occur. And so we're still scrambling this many years after the pandemic. Vaccination is one of the factors that we know reduces the risk of long COVID. So we know that if you're vaccinated, and especially if you're up to date with your vaccine and you get a SARS-CoV-2 infection, your risk of long COVID is less. What we don't know is whether vaccination after the symptoms of long COVID appear is beneficial or not. There is contradicting evidence. And that really stems from the fact that we still don't know what causes long COVID. We don't know if it's persistence of virus, in which case vaccination after the symptom develops might be useful, or whether it's some other condition, some other cause, in which case vaccination after the symptoms develop might not be so useful. So in short, yes, definitely vaccination reduces the risk of long COVID, but vaccination as a treatment remains unclear. Long COVID is interesting to compare to other post-viral conditions. I think what long COVID has really done is highlight actually probably how prevalent post-viral conditions are. So we do see a lot of overlap between the symptomology and sometimes the biomarkers of long COVID and ME/CSF. And ME/CSF, the cause is unknown, but there's been a lot of evidence linking it to an Epstein-Barr virus infection. So again, it's generally regarded as a post-viral disease. We now know of other post-viral diseases. For example, we know the link between Epstein-Barr virus and multiple sclerosis. So there is actually a lot to learn from other post-viral diseases. And And this is where we can look for biomarkers that may be shared or maybe distinct treatments again that work for one may work for the others or may not. But I think what long COVID has really done is highlight the fact that post-viral illness is more prevalent than we initially anticipated, and it represents a real health burden. Unfortunately, the most promising approaches to treatment and management vary a lot. And this is because long COVID is a really heterogeneous condition. It covers over 200 different symptoms. It can be of different severity, different duration. And so sometimes the treatment that works for one individual will not necessarily work for other individuals. There are treatments being tried. So some common treatments include things like low-dose naltrexone, IVIG therapy. We also have people trying anti-inflammatories. There are clinical trials looking at antivirals. There's lots going on in the space, but there's not one specific treatment. And most of the time, if you present to a long COVID clinic, the treatment will be symptomatic largely. And really, that's where we need to advance the field to get more concrete treatments. And even if it's only for a subset of patients with a subset of symptoms or something predefined, we really are lacking treatments, specific treatments for long COVID. The key message that I want you to walk away with is that long COVID is real. Long COVID is more than just somebody feeling tired and having an off day. I talk to people living with long COVID, and this condition has upended their lives. There are people who are now bedbound, who can't walk properly. There are children who have been unable to finish school or engage with their peers. We've talked to 40-year-olds who were forced into early retirement because they no longer have the energy for their work. It is a real condition, and I think we really need to start respecting people with long COVID when they report their symptoms, not saying, oh, it's just in your head, and then also investing in trying to understand the causes, develop treatments, and ultimately understand how this occurs so that hopefully in the next viral pandemic, we don't have this long tail of clinical illness that affects so many people.